Good afternoon, everyone, to the Health and Human Service and Public Safety Committee. I would like to call this committee meeting to order. Thank you all for joining us today. We do have a full agenda today. We are going to start we do have a briefing by the Family Justice Center, but if you all don't mind, we're going to start with some of the legislation that we have first, and then we're going to go into the briefing. But before then, can we call the roll?
Chair Blagay,
Present.
Vice Chair Fisher, Councilmember Olson, Council Vice Chair Oriala,
Here.
Councilmember Watson.
Present.
3 members present at roll call. Oh, 4 members
Councilmember
present at
Austin
roll
is
call.
yes.
Thank you.
All right. Well, we're going to be moving some things around. So we're going to start with CR 11, a resolution concerning the Prince George's County Correctional Facility Safety Task Force. You all can come up and join us here.
Madam Chair, as the Director of Corrections arrived in front of us, could we take a moment of silence for his Philadelphia Eagles? And
It's hilarious.
We got a ring. Okay. Thank you very much.
Small fact that the school is Saquon. Each other at board meetings.
All right. CR 11 established a task force to gather information, evaluate, and make recommendations for improving safety, especially for inmates and employees within the Adult Detention Center for the Prince George's County Department of Correction, also known as the Prince George's County Jail. Ms. Eubanks, do you want to give an overview?
Yes, please. Thank you. Good afternoon. CR 111, 2025, proposed by the chair at the county executive's request, was introduced on October the 7th, 2025, and referred to the Health, Human Services, and Public Safety Committee. This resolution would create a Prince George's Correctional Safety Task Force focused on the county's correctional facility. The final written report shall be no later than 1 year after the adoption of this resolution, with a 180-day extension on the final report deadline as determined by a majority vote of the Prince George's Correctional Facility Task Force. The task force would gather information on the safety conditions inside the jail, evaluate how incidents like violence are being handled, review monitoring practices and how well the facility is supervised, develop recommendations to improve safety for both inmates and staff. The task force will be composed of representatives from the Department of Corrections, the Office of the Sheriff, the State's Attorney's Office, the Public Defender's Office, County Council, community advocacy organization, and other stakeholders with expertise in public safety and corrections. The chair will be appointed by the council chair and must be a non-county employee. The vice chair will be appointed by the county executive and must also be a non-county employee. Mr. David Williams, legislator and budget analyst, will provide an overview of the policy and physical impact statement. Thank you.
All right. Thank you, Mr. David Williams.
Good afternoon. Thank you very much, Madam Chair, members of the committee. The Department of Budget and Policy does not anticipate that this particular resolution will have any significant adverse impact on the county. Thank you very much.
All right. Thank you. And now turn it over to our main sponsor, Councilmember Hawkins.
thank you, Madam Chair. I believe everything has been said. This is an opportunity to just review and work with our current director and his team to better advance what is occurring there and to determine really the importance of building a new facility to help with what we do at the Corrections Department. Thank you.
Thank you. And I definitely wanted to hear from our agency representatives. We have our director here, and we do want to hear from, I believe they said that wrong one.
The Philadelphia Eagles.
Yeah, so we have our Director Clark and then the Deputy Director. And so you all can get started.
All right. Good afternoon, members of council. We look forward to working with the task force. We look forward to any opportunity to improve our situation through collaboration. And we have no issues with the resolution in its current form, the way it's written.
Thank you. Anybody else? Mr. Guy, did you have anything to add? All right. Is anybody else at the Jeffrey Logan? Did you want to add anything? All right. Thank you. And we're turning it over to Sonia from Owens from Council, the liaison in the County Executive's Office.
Thank you, Chair Blagay. The only request by the administration, they are in favor of this legislation, if it's okay with the sponsor, Councilmember Hawkins, that there would be an addition, that there be a feasibility study to determine if the safety goal may require the creation of additional facilities, either for standard detention or for mental health, because that might be what's needed for this to actually work. And if Councilmember Hawkins is okay with that, we would just ask that you add that. But we are in favor of this legislation. Thank you.
Thank you so much, Councilmember Fisher. Chair Fisher.
I was gonna move to adopt that amendment if the sponsor's okay.
Thank you, Madam Fisher.
Second.
Great.
Okay, it's been moved and seconded to that it would be an amendment feasibility study. Can we call the roll?
Chair Blagay,
Aye.
Vice Chair Fisher,
Aye.
Oh wait, did you say aye for me?
Oh, I'm sorry. Oh my God. Aye. I'm sorry.
Aye. Well, for myself.
okay. Councilmember Olson,
Aye.
Council Vice Chair Oyaba.
I vote aye, and I just want to thank you all that you understand it doesn't cost $1 million to think. I hope we could talk to some of your other agencies.
Oh, God.
But I vote aye.
Councilmember Watson.
Ooh, how do I follow that? I vote aye and explaining my vote. I want to thank Councilmember Hawkins for his leadership on this, and thank you all for everything that you do, especially on a daily basis. Appreciate you.
Motion carries 5-0.
Do we have a motion?
I have a motion favorable as amended to be draft 2, and I had a question for the sponsor.
Okay, I'll second that. But if you want to, Councilmember Fisher, did you want to ask your question? Yeah.
Yes, and maybe it's also for a question for you, Madam Chair. Councilmember Hawkins, like the other work groups, will you be chairing and be the main one, making sure the meetings happen and facilitating this?
I would be honored to do so, but the chair will select
The council member appointee?
yes.
Oh, okay.
But with your help, we may convince him to select me
Okay.
and appoint me.
Okay, I just wanted to make sure. That was it, Madam Chair. Thank you.
All right, we have a motion and a second. Can we please call the roll?
Chair Blagay,
Aye, and thank you, Councilmember Hawkins, for your leadership on this. This is definitely needed, and we appreciate your efforts.
Vice Chair Fisher,
Aye. Thank you.
Councilmember Olson,
Aye.
Council Vice Chair Oyaba,
Aye.
Councilmember Watson.
Aye.
Motion carries 5-0.
Madam Chair, before you go, are you going to honor the moment of silence for the Philadelphia Eagles fans?
Nah, he playing around now. All right, so next legislation on the agenda is, just want to make sure, following the list here, is CB 61. An act concerning police vehicle pursuits, conduct, and reporting, Zoe's Law, for the purpose of clarifying the circumstances under which the Prince George's County police officers may engage in vehicle pursuits, encouraging officers to minimize pursuits when enforcement can be safely delayed, providing administrative review of vehicle pursuits, and requiring annual reporting on vehicle pursuit data. Turn it over to Ms. Eubanks.
Thank you. CB 61, 2025 was presented and referred to the Health, Human Services, and Public Safety Committee on June 17, 2025. CB 61, 2025, also known as Zoe's Law, focus on how police officers in Prince George's County conduct vehicle pursuits. The bill makes clear that pursuits should only happen under specific circumstances and encourage officers to avoid chasing suspects as it is safer to wait. To ensure accountability, the legislation requires every vehicle pursuit to go through an administrative review process and direct the police department to compile annual reports on pursuit activity. We have a draft 2 before you today. Mr. Irvin will review the amendments, and we have Mr. David Williams, the legislative budget and policy analyst, will review the policy analysis and impact statement, and we have Mr. Joseph Rudy, Deputy County Attorney from Office of Law, here today. Thank you.
Thank you so much. Now turn it over to Mr. David Williams. He stepped out, okay. Then now turn over to Mr. Eric Irving. Oh, David, you're back. Okay, you can go ahead first.
This is regarding CB 61. The fiscal policy note that you have before you reflects draft 1, as I didn't get draft 2 in time to craft another. However, we don't estimate that there will be any noticeable adverse impact on the county regarding this particular bill at this time.
Thank you so much. Okay, and Mr. Irvin?
Thank you, Madam Chair. So draft 2 of CB 61 takes a slightly different approach in recognition of the standards that already exist in the Prince George's County Police Department's general orders. And I don't want to speak out of turn for the sponsor that there was a decision to remove the sections that adjusted the policy while retaining the reporting information. And so you'll see that reflected in the changes to the title on page 1, lines 3 through 5. You'll see that those are struck, as well as the references to section 18175 in pages on page 1, lines 12 and 16. The bulk of those changes are you'll find on pages 2 and the top of 3, where all of those sections are effectively struck. The second thing that the proposed draft 2 does is to, in recognition of the fact that we want to have all of the local municipalities in the county to have, at a minimum, the same vehicle pursuit standard that Prince George's County the county police department has. It adds a section in section 18189, which requires that the mutual aid agreements that the county has with the local municipalities, that those mutual aid agreements incorporate a requirement that that police department has the minimum standard that the Prince George's County Police Department has. And so, again, you'll see that reflected both in the title on page 1, lines 6 through 9, but primarily you'll see it on page 3, lines 24 through 27. It reads, any mutual aid agreement with any municipal corporation, city, town, or village within Prince George's County must provide that such municipality shall adopt the standards for initiating vehicle pursuits contained in the Prince George's County Police Department general orders. Additionally, in this proposed draft 2, there's obviously a recognition that not all of these aid agreements may be up to date, and so there's a desire to make sure that we're updating those agreements so this bill is actually effective. And so on page 3, lines 28 through 31, there's a uncodified section that reads, be it further enacted that the county executive shall make every reasonable effort to update each mutual aid agreement between Prince George's County and a municipal corporation, city, town, or village to comply with the provisions within this act within 6 months of the effective date of this act. I think the county execs team has a couple of additional amendments that they want to discuss, but that's how draft 2 is different from draft 1.
Thank you. I'll turn it over to our sponsor. Turn it over to Vice Chair.
Thank you. As many of you know, Zoe's Law is a law that came about after the tragic death of little Zoe, a 3-year-old that was just on her way to celebrate her cousin's birthday party. And her mom put her in the car seat and went to drive to the party. And because of no action by obviously little Zoe or the mother, she's no longer with us anymore. And during that same time, sadly, we had 2 other residents die in similar cases within 30 days of each other. And so as a lot of families, they were taking their pain and loss and wanting to do something and turn it into purpose. And so that's where this legislation has come from. After talking with the chief of police and talking with the police union and talking with the administration, we came up with draft 2 as a compromise because there was some language that is already in the general orders from Prince George's County Police that would have been more restrictive than the legislation. And then some of the issues that was brought forward by PGPD was the difference between the municipalities and obviously the county. And really wanting to make sure that any agency that we work with follows a minimum of the standards that are in the general orders, but could do more than what's there. And, you know, we also are looking at state legislation because we know it's important that our police use sound judgment when pursuing suspects, but it's also equally as important that we show that if you do run and evade the police and it leads to death, murder, that you'll be held accountable. So I'm thankful that Delegate Chair Nicole Williams is championing legislation to make it a felony, not a misdemeanor. So these are companion legislation pieces, but I'm hopeful that we can pass this legislation here on the county level. So thank you.
Thank you so much. Thank you for your efforts on this. And now we will turn it over to Joseph Ruddy from the Office of Law.
Council Chair, first, good afternoon, everyone. And is there a way we could just push this to Ms. Owens because she has amendments to offer first?
Okay, I will turn it over, Ms. Owens.
Thank you. If I have Vice Chair Oriada's permission to read the, thank you. They're very minor amendments. On page 3, line 24, after the word corporation, we're asking that you add or other law enforcement agency. And on line 25, before the word standards, add the word minimum. And the only other request, but I will defer to the Office of Law on the legalities of it, is that the law apply prospectively. And with that, that's all we have. We do favor this legislation. Thank you.
Thank you so much. We would, do we have a motion to move forward? Do you, motion to move forward with it? Do you have any comments before we do that?
No, I would be accepting the 2 amendments that were read. So I don't know if you wanted to make a note about the prospectively part.
Okay, and I would, now that Ms. Owens, I didn't turn to Denora. Denora, do you have any comments?
Yeah, no, in regards to the prospective, legislation, unless otherwise specifically stated, is prospective beginning the day of its effect. So it's implied that it's prospective.
Okay. And Mr. Ruddy, did you want to say anything?
Yeah, just real quickly, the chief and the assistant chief would have been here today to express their support for your legislation. They are attending the funeral services for police officer first class Alex Belcher, who passed away in the last week. So they wanted to make sure that they had someone here, and they wanted to know that they are asking they are supportive of the legislation, and they wanted to know that they would have been here but for those services.
Okay, and if you could send draft 2 over to Councilmember Fisher, because she does not have a copy of it. All right, so thank you. Any questions or comments from committee members?
No, I'd like to make a motion.
Okay.
Motion to move favorable with the two amendments that were listed.
Second.
Second. We're doing the
Draft
the
two.
draft
sorry.
two, and then, okay. So we have a motion and a second. Can we please call the roll?
Chair Blagay,
Aye.
Vice Chair Fisher. Councilmember Olson,
Aye.
Council Vice Chair Oyala,
Aye.
Councilmember Watson.
Aye.
Motion carries 5-0.
Okay, now we have a motion to move forward with.
Okay.
Oh, you tried to do it, okay, because are we allowed to do it together?
Together.
Okay, so then we're done, so we're done. Well, thank you all so much, and thank you for your leadership on this. We do continue to keep prayer for the family that lost their Zoe. The next bill on the agenda is CB 84, 2025, an act concerning senior protection and door-to-door solicitation for the purpose of amending the requirements for licensing, bonding, and operational conduct of door-to-door solicitors, establishing definitions for high-risk industries and seniors, requiring criminal background checks and mandatory consumer protection and elder fraud awareness training for certain applicants, increasing bond amounts for high-risk industries, requiring senior consumer rights disclosure, creating a no solicitation registry, and prohibiting solicitation of registered properties, establishing a solicitation protection rapid response force to investigate violation and conduct public outreach, and providing an enhanced penalties for violations, including specific protection for seniors and restrictions on repeat offenders. Okay, turn it over to Ms. Eubanks.
Thank you. CB 84, 2025, strengthen protections for door-to-door sales for seniors. It requires solicitors to provide clear information, carry ID, and give written contracts while allowing a cooling off period for cancellations. A draft 2 has been provided for the committee's consideration. Ramon Gonzalez will go over the changes. We have today Ms. Laurie Paris, Administrative Specialist on behalf of DPI, and they have also provided written comments that's in your packages, and Elena Balam Butler from Director of Family Services here as well.
Okay, I'm turning it over. Okay, you finished?
I was just going to make one other comment that we have Mr. Joseph here to go over the policy analysis and impact statement. Thank you.
Okay, Mr. Joseph?
Good afternoon to the members of the council. If enacted, CB 84 2025 would potentially require new county expenditures for staffing, training, and technology. DPI notes that this would involve upgrades to its licensing system, momentum, and the hiring of at least 5 investigators to enforce what it calls an unfunded mandate. Indirectly, it could reduce fraud against seniors, lessen financial harm, and ease pressures on social services through high-risk industries that may face added compliance costs. Thank you.
Thank you. Now turning it over to Ramon. I'm turning over to our Vice Chair Orietta.
Thank you. This legislation for senior protection, specifically on door-to-door solicitation, I'm sure is an issue that a lot of my colleagues have dealt with as well. It was birthed after a senior reached out to me who had dealt with solicitation at their door around solar panels and a new roof, and now owes upwards of $10,000 more than what they expected to pay, and trying to understand what to do, who could help them, and it led me to start to look at what are the current rules and regulations and what's the punishment and how are we tracking it, and we talk about a lot how we can protect our seniors, and we know they're the most vulnerable when people show up to their home and promise them things, and maybe they don't understand what they're reading, and they don't understand the laws and protection that they already have. And so I think it's really important that we do 2 things. One, we hold these companies liable in a way for their solicitors that are in their community. And if they continue to violate, that they're no longer able to solicit in Prince George's County. That we also do our due diligence to educate our seniors, and then also make the companies responsible for some of that education. A reminder, we're not able to always reach every senior at community meetings that we have and, through social media. But if there's that check and balance that before they sign a contract, they have to be reminded of their rights. They have to be reminded that they can change their mind, that they have to sign that they gave this information to the senior. I just think that would be helpful protection for our seniors. And it shares the burden. It doesn't put the entire burden on agencies. It puts the burden and responsibility on these companies to move in a fair way and to treat our residents with respect and dignity. So I hope that we'll be able to pass this legislation, because I think it's very important that as we see so much fraud and theft of our seniors, that we do everything within our power to protect them. So thank you.
Thank you so much. And I want to turn it over to Ramon Gonzalez. Yes, thank you.
Thank you, Madam Chair, and good afternoon, council members. I'm going to give you a brief overview of the changes in proposed draft 2. There were some changes in definition and the name usage for clarity. There was removal of certain penalties, and there were some changes in responsibility in the agencies and different agencies tasked with different provisions of the bill. On page 2, line 31, you'll see the first major change, the strike through of the provision of the division. That definition will no longer be in proposed draft 2. On page 4, lines 9 through 14, you're going to see the addition of any applicant engaged in a high-risk industry will be subject to a criminal background check, and the new lines reading and fingerprinting through the Maryland Department of Public Safety and Correctional Services, DPSCS, and the applicant is responsible for all the costs of these services. On lines 12 through 14, you're going to see the strike through of the division and the insertion of the Department of Family Services for name clarity. On page 4's line 22, you're going to see the strike through provision of a quick response code, a QR code that verifies the licensee. And on page 7, lines 12 through 15, you're going to see the strike through of the director, which was DPI, which we insert now Department of Family Services, and the removal of, on line 18, page 7, of the hotline number to report fraud or undue pressure. And then on page 8, lines 1 through 12, you're going to see the removal of engaging and soliciting in any property that has opted into the no soliciting registry. That prohibited act has been struck and through. And on lines 22 through 31, you're going to see removal of lines of the penalties for anyone soliciting in the no solicitation registry. And on page 9, you're going to see the removal on lines 6 through 12, the removal of the no solicitation registry. And on page 9, 21 and 24, you're going to see the strike through of division and the insertion of Department of Family Services. And I believe there will be one more amendment that will come from the bill sponsor afterward.
Okay, did you want to talk about that amendment now?
Yes, if you look on, thank you. Which one are you referencing? I don't see a note on my screen. Yes, that's on my other notes. Thank you for that. I apologize. I wrote on a different copy. Okay, so on page 9, in the section solicitation protection rapid response force, One of the concerns was specifically about the response within 3 days. So I would be removing the time commitment there. It'll also be the Department of Family Services shall establish the Solicitation Protection Rapid Response Force to investigate reports of potential violations. And I will also be striking the on-site inspection. And then again, where it says division on line 17 and line 18, it would change to family services. And that will complete all of the amendments for draft 2.
Okay, thank you. Now, we don't have Lori Pellis. There's no one from DPI here, right? I don't see anybody from DPI, but Miss Elena Bellin Butler from Director of Department of Family Services. We'll turn it over to you.
Hi, good afternoon, council members. I'd like to, for a moment, Chair Blagay, if it's okay with you, defer to Ms. Owens. I don't know if you have any additional comments before I speak.
Well, she'll speak after you. Go ahead.
Okay. So thank you very much for the opportunity to be before you and to address this body. Overall, the Department of Family Services is in support, as we indicated yesterday during a meeting with Councilmember Ariada of this legislation. I did want to point out again to this body is that the Department of Family Services is not an enforcement agency. We are not a licensing or regulatory agency. So thus we don't have the authority to enforce regulations or protections for Prince George's County residents. We do, however, have the ability to educate our residents as well as train and provide outreach, which we believe is a great opportunity to partner with the newly established Office of Senior Services in order to do that. So we are willing to, and we are in a position to do that. And we've already started those discussions internally. Thank you.
All right, turn it into Ms. Owens.
Thank you. Vice Chair Arietta, I want to apologize because I'm in the same position now that I was last night. The administration wanted to continue discussions, and I am here right now with no position, and I apologize for that. Thank you.
All right. Do we have a motion?
Yes, I'd like to move favorably on draft 2 with the amendments that I stated.
Okay, draft 2 with amendments. I'll second that. Can we please call the roll?
Chair Blagay.
Aye.
Vice
Aye.
Chair Fisher. Councilmember Olsen.
Aye.
Council Vice Chair Oriada. Councilmember Watson.
Aye.
Motion carries 5-0.
All right, thank you. All right, we are now moving to CR 99. A resolution concerning Black maternal health, accountability, and patients' Bill of Rights for the purpose of participating and encouraging the creation of a operational framework to address healthcare disparities, particularly in the areas of Black maternal health in Prince George's County. Can we turn to Ms. Eubanks for an overview?
Yes, thank you. Good afternoon. CR 99, 2025 addresses the issue of Black maternal health disparities within the county. The resolution calls for the creation of a comprehensive operational framework aimed at identifying and rectifying the systemic barriers contributing to adverse maternal health outcomes among Black women. The resolution shall establish Black Maternal Bill of Rights checklists, Your Voice Matters Maternal Experience Survey, Black Maternal Health Equity Task Force. Health officers shall partner with the hospitals and establish a Black Maternal Health Fund Advisory Group. We do have a proposed draft 2 for your consideration, and Mr. Maddox, the attorney, is prepared to review the proposed changes. We have also Mr. David Noto, legislative and budget and policy analyst, will review the policy analysis and impact statement. Thank you.
Thank you. Turn it over to Mr. Noto.
Good afternoon, Chair Blagay and members of the HHSPS committee. My name is David Noto, and the following is my analysis of CR 99 2025. You'll find my report on page 57 of your virtual binder. Thank you, Ms. Eubanks, for that overview. CDC has estimated that Black women are 3 times more likely to die of complications associated with pregnancy and childbirth compared to other racial and ethnic groups. Structural discrimination, socioeconomic conditions, and provider biases are widely understood to be the cause of these disparities, and over 80% of pregnancy-related deaths among Black women would be preventable with improved care. In 2023, 4,565 expecting mothers in Maryland received late or no prenatal care. Over a quarter of these mothers were Prince George's County residents, more than any other county in the state. Prince George's County also had 86 fetal deaths, 70 perinatal deaths, 52 neonatal deaths, and 79 infant deaths in 2023, more deaths in each category than any other county in the state. These grim numbers underscore the necessity of improving neonatal and maternal care for Black mothers and county residents. CR 99 could be seen as a continuation of CR 90 2023, which established the Black Maternal Health Fund. CR 99 establishes a Black Maternal Health Fund advisory group, which would provide recommendations on allocation and disbursement of funds from the Black Maternal Health Fund. As such, any direct fiscal impact would be limited to decisions of the advisory group as to the distribution of funds. Thank you. This concludes my analysis.
All right, thank you so much for that. And then we will be turning it over to Bill Sponsor first.
Thank you. As many know, I've been working on Black maternal health issues now, I think for all 3 years that I've been serving in this seat. As a new mom, a lot of things were brought to my attention. We see the statistics firsthand, but when I lived through that experience where I wasn't believed, my pain wasn't taken seriously, and it almost cost the loss of my child, it really put in perspective the importance of investing time and energy into Black maternal health. When we look at the statistics and the numbers when it comes to Prince George's County, it's shameful. It's shameful because most of our leadership looks like me. But the reality is that you're more likely to die as a Black woman giving birth in Prince George's County than other other jurisdictions in this state. And we have a higher rate of infant mortality in Prince George's County, and especially in my district. So I worked tirelessly to get funding initially for to create the Black Maternal Health Fund, to get funding for the Black Maternal Health Fund. And then we are working on legislation on the state to create an advisory board across the state of Maryland to focus on Black maternal health. And the goal here is to take the work that's been kind of having offline with some of the hospitals and create some standardized surveys, a standardized group that can look at the issues, and then also help us navigate how those resources should be spent. So again, I hope to have the support of my colleagues. I think this just gets us one step closer to the work that we've been doing around making it safe to be a Black woman to deliver here in Prince George's County. Thank you.
Thank you. Excellent work. Let's turn over to Mr. Maddox.
Yes, thank you, Chair Legay. What you have before you is proposed draft 2. These changes are really technical in nature. You'll see on page 2, line 2, we change from is to has, so it will read, the checklist shall read aloud at labor and delivery intake, shall be read aloud at labor and delivery intake and signed by the individual giving birth to their spouse or the individual who has the designated medical power of attorney. Also on page 2, line 16, we changed the section, so it says consist of aggregated results of the survey which shall be reported to the county health department. So I'll read it in its entirety. May it further be resolved, be it further resolved that the health department shall promote the Your Voice Matters Maternal Experience Survey, the survey, which shall consist of aggregated results of the survey, which shall be reported to the county health department. Also on page 2, line 25, it'll say, be it further resolved that the health department, instead of the health officer, shall partner with hospital and providers. And that is the extent of the changes to the legislation.
Thank you so much. This is really helpful. So now we're going to turn over to the health department, and I see that we have Dr. Diane Young here.
Thank you, Madam Chair Blagay, and the distinguished members of this committee. I am Dr. Diane Young. I've served with the Prince George's County Health Department since 2012 as the Associate Director for Family Health Services, overseeing programs that touch every stage of life, from maternal child health to reproductive health, WIC, immunizations, infectious disease, and chronic disease prevention. It is an honor to represent the department today in strong support of CR 99/2025. This resolution could not be timelier. Black women in this county and across this nation continue to bear the heaviest burden of maternal death, severe complications of pregnancy, and disrespect in healthcare settings. These are not abstract statistics that we've heard today. These are mothers, daughters, sisters, and community leaders whose lives are often cut short or forever changed by preventable causes. Keep in mind that these severe maternal morbidities are 80% preventable. I want to begin by acknowledging that this moment exists within a broader context across this national landscape, where the rights and safety and dignity of Black women are constantly under political and social attack, from reproductive autonomy to healthcare access and representation. Black women are navigating a system that too often questions their pain, disregards their voice, and devalues their humanity. This constant stress is not just emotional, it is physiological. Public health research describes this as allostatic load, which refers to the cumulative wear and tear on the body that results from chronic exposure to stress, systemic inequity. And over time, these stressors accelerate biological aging. They alter the immune system and our cardiovascular function, therefore increasing our vulnerability to illness. This is closely related to the weathering hypothesis, which shows that prolonged exposure to racism, to discrimination, to economic hardship causes premature health deterioration in Black women. It manifests in higher rates of hypertension, preterm birth, and maternal mortality. When we discuss maternal health, we're not simply talking about medical outcomes, we're talking about the embodiment of structural inequities over our lifetime. CR 99 addresses this reality head on. This resolution transforms equity into accountability. The Black Maternal Bill of Rights checklist ensures that every birthing person, regardless of their race, income, immigration status, sexual orientation, is informed of their rights to be safe, to be respected, and to have bias-free care. By requiring that the checklist be reviewed at intake and translated into the county's top languages, this legislation makes equity operational and measurable. In 2022, while completing my doctoral degree, I had the opportunity to contribute to a similar initiative in Washington, D.C., in collaboration with the Developing Families Center. That is a community-based organization that established a maternal health fund to improve perinatal outcomes in neighborhoods within the poorest perinatal indicators, which of course were wards 7 and 8. That experience reinforced what I have long known through my work here in Prince George's County. When we invest resources where disparities are greatest, guided by community voices and local data, we can transform both outcomes and the systems. CR 99 embraces that same philosophy. It not only creates a framework for transparency and accountability through Your Voice Matters Maternal Experience Survey, but also establishes two vital structures: the Black Maternal Health Equity Task Force and the Black Maternal Health Fund Advisory Group. These mechanisms will ensure that women most affected by inequities, along with doulas, clinicians, public health professionals. They all can help shape solutions, not just give solutions. The Prince George's County Health Department stands fully committed to the implementation of this resolution. We will partner with hospitals, birthing centers, doulas, providers, and community-based organizations. Through the steps outlined in CR 99, we will create a feedback loop that not only identifies disparities, but drive change and corrective action in real time. As a doctor of public health and a Black woman that has been on the receiving end of microaggression and implicit bias in healthcare settings, I see CR 99 as both a professional mandate and a personal mission. It tells every mother in this county that we see you, we hear you, and we are committed to protecting you. So Chair Blagay and the members of this body, thank you for your courage and your leadership in advancing this resolution. By passing it and funding the work that will be required, Prince George's County is not only setting a standard for Maryland, but for the nation. You are declaring that equity and respect are not an option in childbirth. They are a fundamental right. Thank you.
Thank you so much. Beautifully stated. Did you turn to Ms. Owens?
Thank you, Chair Blagay. The administration is in favor of this legislation. We would just ask that you consider, as part of the working group, discussing the funding once the program is up and running. And we did ask that someone from the Prince George's County Department of Health be appointed to the working group, specifically Dr. Diane Young, who has agreed to be a part of it, if that's okay. Thank you.
Thank you so much. And Mr. Nor Hernandez?
Thank you, Madam Chair. The Office of Law had an opportunity to review draft 2 and find it to be in proper legislative form.
All right, thank you. Now turning to my colleagues, any questions or?
Just wanted to move favorably. We do have a note for a member from the health department and definitely would be open to serving in that capacity.
Second.
All right, it's and this is the draft two. Okay, so we had a motion and a second for draft 2. Can we please call the roll?
Chair Blagay.
Aye, and thanking Councilmember Oyetha for her work on this. She has taken her experience and used her position to make a difference and be a voice for other mothers who can't be the one to come before us. Thank you so much.
Vice Chair Fisher.
Aye.
Councilmember Olson.
Thank you. I vote aye, and I want to thank Councilmember Oyetha. This is important legislation for so many reasons, and happy to support this. Thank you.
Thank you.
Council Vice Chair Oyetha.
Aye.
Councilmember Watson.
I vote aye, and explaining my vote, I want to also thank Councilmember Oyetha for her leadership. And this is such an important topic, and I'm just proud of all the work that she's done on this, and thank her so much for her leadership.
Motion carries 5-0.
I want to turn it back over to Councilmember Fisher. And I could understand the confusion of what we were voting on.
Sorry, I think we were only voting to go forward on draft 2 and not the whole bill. So I want to explain my vote. I'm sorry. Thank you, Councilwoman Oyetha, for your work in this. It's not easy, and I appreciate the thoughtfulness. I appreciate the health department for taking it on into your additional duties, and it is something that really our community struggles with. I'm excited that on the state level we're covering doulas and other alternative support. So I just want to publicly thank you for your work.
Thank you so much. And now we're going to move on to CR 105, a resolution concerning compensation and benefits for correction officers, salary schedule C-O, schedule of pay grades for the purpose of amending the salary plans of the county to reflect wage and benefit modifications of the Department of Corrections. Turning it over to Ms. Eubanks.
Thank you. CR 105, 2025, proposed by the chair at the county executive's request, was introduced on September 30th, 2025, and referred to the Health, Human Services, and Public Safety Committee. This resolution amends the salary schedule C-O for officials in the Department of Corrections effective July 1, 2024 through June 30th, 2026. This legislation is necessary to implement certain modifications to the wages and benefits of captains and majors in the Department of Corrections. The salary plan amendment includes cost of living adjustments, 2 3/4 effective in the first and for 2025, and 2 1/2% effective in 2026. Merit increases in both fiscal years on their anniversary date. Mr. Malcolm Moody, Legislative and Budget Policy Analyst, will provide an overview of the policy and fiscal impact statement. Thank you.
All right, turn it over to Mr. Williams.
Yes, good afternoon. Thank you very much. Just small clerical error that was a result of interdepartmental communication, but OMB provides a statement that dictates between fiscal years 2025 and 2026, approximately $127,910 will be the county's fiscal impact. And then every year thereafter will be $100,506 for the shift differential and cost of living adjustments. Thank you.
All right, thank you. And then going over to Ms. Owens.
Thank you, Chair Blagay. We will ask for favorable consideration of this legislation, and we do have Jatana Stewart Ponder on behalf of OARM if you have any questions. Thank you.
All right, thank you. Ms. Sonora Hernandez.
Thank you, Madam Chair. We find this legislation to be in proper form. Thank you.
Okay, do we have a motion?
Madam Chair, I move favorable.
Second.
All right, can you please call the roll?
Chair Blagay,
Aye.
Vice Chair Fisher,
I vote aye, and explaining my vote, I love the Department of Corrections. I come to a lot of your graduations, and I'm very thankful for the work that you do, and it's a very unsung role in our public safety matrix, and I'm just really grateful. So I vote aye.
Councilmember Olson,
Aye.
Council Vice Chair Oyada,
Aye.
Councilmember Watson.
Aye.
Motion carries 5-0.
All right, thank you so much. Now we will go to our next one is CR 106, a resolution concerning the compensation and benefits of police officers, salary schedule P-O, schedule of pay grades for the purposes of amending the salary plan for the county to reflect wage and benefit modifications of police officials. Turning it over to Ms. Eubanks.
Thank you. CR 106, 2025, proposed by the chair at the county executive's request, was introduced on September 30th, 2025, and referred to the Health, Human Services, and Public Safety Committee. The resolution amends the salary schedule P-O for officials in the police department effective July 1, 2024 through June 30th, 2026. This legislation is necessary to implement certain modifications to the wages and benefits of captains and majors in the police department. The salary plan amendment includes cost of living adjustments, 2 3/4% effective in 2025 and 2.5% effective in 2026. Regular merit increases for both fiscal years. Mr. Malcolm Moody, Legislative and Budget Policy Analyst, will provide an overview of the policy and physical impact statement. Thank you.
Thank you so much. And turning it over to Mr. Moody.
Hello, Malcolm Moody with the Budget and Policy Team. I'm just going to go over the fiscal impact real quick for this resolution, and just to highlight over the next 2 fiscal years. So for fiscal year 2025 and 2026, the fiscal impact will be $1,195,288 over 2 fiscal years. And after fiscal year 2026, the impact will be over $963,816. That's all I want to add.
Okay, thank you so much. And Ms. Owens?
Thank you, Chair Blagay. The administration is asking for favorable consideration of this legislation. Thank you.
All right, Mr. Nora Hernandez.
Thank you, Madam Chair. The Office of Law finds this legislation to be in proper form. No legal impediments.
All right, colleagues, do we have a motion?
Move favorable.
Second.
All right, we have a motion to move favorable and a second. Will you please call the roll?
Chair Blagay,
Aye.
Vice Chair Fisher,
I vote aye.
Councilmember Olson.
Aye.
Council Vice Chair Oyada,
Aye.
Councilmember Watson.
Aye.
Motion carries 5-0.
Okay, thank you all so much. So now we're going to turn to briefing, but Ms. Eubanks, I want to clarify something. Is it is CB 12 and CB 11, CR 12 and CR 11, two different ones? Is that Calvin's bill too? Got it. Okay. Oh, there's something I got confused. Okay. All right. I see. Because I have task force here. Yeah, but I think that's what the thing had a task force. Okay. CR 112, a resolution concerning compensation and benefits for sheriff officials, salary schedule S-O, schedule of pay grades for the purposes of amending a salary plan of the county to reflect wage and benefit modifications of sheriff officials. I'm turning it over to Ms. Eubanks.
Thank you. CR 112, 2025, proposed by the chair at the county executive's request, was introduced on October the 7th, 2025, and referred to the Health, Human Services, and Public Safety Committee. The salary plan amendments includes cost of living adjustments, 2 3/4, effective for fiscal year 2025, and 2 1/2, effective January 2026. Employees who are eligible for a regular merit increase will receive it on the anniversary of their original hire date for both fiscal years 2025 and 2026. Mr. Malcolm Moody, Legislative and Budget Policy Analyst, will provide an overview of the policy and physical impact statement for CR 112, 2025. Thank you.
Thank you, Mr. Moody.
Hello again. I'm just going to provide the fiscal impact real quick. And over the next 2 fiscal years, it'll be $175,568, and this agreement would currently cover 11 employees. That's all I want to add.
All right, thank you.
Motion favorable.
Okay, there's been a motion.
Second.
All right, a motion and a second. Can we please call the roll?
Chair Blagay,
Aye.
Vice Chair Fisher,
Aye.
Councilmember Olson.
Aye.
Council Vice Chair Oyala.
She stepped away.
Oh, Councilmember Watson.
I vote aye.
Motion carries 4-0.
All right, thank you so much. And now we would like to call the Family Justice Center to come up for the presentation. We do apologize that this is taking a little long today, but we look forward to your presentation. That's everybody. I'm here. That's fine. I'll wait for Christina. She's not gonna wait. All right. Thank you for joining us today. We're turning it over to you. Turn the middle button. Yep, there you
Okay,
are.
There we go. Well, good afternoon. And first and foremost, let me say thank you for the opportunity to present before you, Chair Legay, Vice Chair Fisher, and of course, members of the committee. I did not really come with a legislative proposal at this point. I really wanted to have an opportunity to share with you more about the Family Justice Center, which I know you're all very much aware of and familiar with the work that we do. But realistically, hoping that we could at least begin a discussion about how we can move forward to ensure our sustainability. And thank you for putting that up. I appreciate it. We were established, as you all know, in 2016. And okay, how's that? And who's going to control that? You? Okay, if you could go to the next slide, that would be great. So again, as I said, we were established in 2016, and it was a collaborative effort with a very diverse group of stakeholders that all saw the need to really improve systemic responses to domestic violence. At that time, we were really experiencing several very high-profile domestic fatalities. And even today, I will point out, we continue to have the highest number of orders of protection filed in the state. So this has been a very long-standing critical issue for Prince George's County. The court, as you know, stepped up. There were several departments that really wanted to take the lead, but the court, for several reasons, was identified as the lead, largely because it was more advocacy-based. We did not want the county or survivors to be in a criminal justice setting, so the court took on this lead to set up and stand up the Family Justice Center. If you could go to the next slide, please. And it was just that, a real partnership. We have 6 governmental agencies as well as 16 local community organizations that are all there together in one location, making resources and services available to survivors in a very seamless, holistic, and client-centered manner, which has proven to be very, very effective. I will note there have been several domestic fatalities throughout the years since the Family Justice Center has been established. Not one victim has been in the Family Justice Center. So I point that out to state to the fact that we have been really effective in helping to keep people safe. They have access to information, resources, and services that does make a difference. Of note, we have 6 law firms in the Family Justice Center. That's been one of the primary services that an individual needs, and research has also shown that it is the one service that has been really effective in helping an individual move from their abusive situation. Next slide, please. When we opened our doors, there was really only me. We had one staff person. That's all the county was able to support at that time. With the support and help of grants, we are now at 10. We have 10 employees that are working, doing several things there to meet their needs, from case management, intake advocacy, outreach, all of the services that an organization will need. Next slide. To date, we have served over 10,000 survivors in Prince George's County and have made referrals to over 160,000 individuals. Again, speaking to the impact of the work that we're doing. Again, looking at some of those services, next slide, you can see we run the gamut from criminal civil justice, advocacy, supportive services, outreach and education, all of which are desperately needed and do make a difference in the lives of survivors. If you look at the next slide, you'll see that the largest area, which is not just Prince George's County, but in general, is housing. We continue to have a dearth of housing for survivors. There just aren't enough. Legal services, as I pointed out, are also significant. Social services, we're helping them get access to, food stamps, housing vouchers, things that have been known to keep an individual in an abusive situation because they've not been able to sustain themselves. We're even providing forensic exams. As you all know, strangulation is now a felony, and that is something that we're able to identify immediately with the support of our enforcement officers that are working in the Family Justice Center. I know at the meet and greet that we had, and I thank those of you that were there, and those that sent representatives. Next slide. The question was asked of me, well, what's going on in your respective districts? So I was able to pull data for the last year. And this is an overview of who we are serving in the county. There are others that are not shown there because they're not necessarily in our county, and some even out of state. The requirement for services in the Family Justice Center is that you have to either reside in the county or the victimization had to have occurred in the county. So you will see that we've had individuals that don't live here but were victimized here. So those individuals are not shown. But this does give you somewhat of an overview to see that we are across the county making these resources available to all of your constituents. Next slide, please. And again, I talk about this because we're doing things that we're the 3rd Family Justice Center in the state. You may know Harford County was the 1st. Montgomery County has a Family Justice Center, and we are now the 3rd, but we are by far the best for several reasons. One being that we are a certified affiliated organization, and we're doing things that are not just for the immediate crisis, but we're looking at this more holistically, even to preventative measures, which is our Camp Hope program. We're now taking children to a mentoring and camping program 5 days overnight where they're learning healthy relationships, coping skills, resiliency, character building, all of which we know are important to help them break that cycle of abuse. Next slide. So, as I pointed out, and you can go to the next one, this is really why I'm here, because I wanted you to look at where we are from a funding perspective. Approximately 75% of our budget is all from grants. We are in a very, very dark time right now as a country, and I know who I'm talking to, even here in the county. I know that there's a real issue, shortfall with dollars. But the reality of it is that we cannot live and die on grants. We've lost about 30% of our grants because of just cuts and the administration's priorities, which really don't value or recognize that women and children, largely women, however, are suffering at the hands of their abusers. And even to some extent, marginalized populations, which we've had to remove from some of our literature because that is no longer even something that is eligible for funding. With that said, we have lost our ability to really leverage those dollars because they're just scarce and we can't even depend on them going forward. We are grateful for the support that we currently get from the county, and I will tell you that that money is from really covering our overhead. The building that we are in is not owned by the county. We're there as tenants. It's a lease building, and the county is paying for the rent as well as the utilities in that building. The court's general fund funds one position, and that's mine. So all of the staff that you saw, the 10 employees, I put that there for a reason. They're all grant funded. 2 of them are considered administrative from one of our funders, and they've no longer want to fund administrative staff. So I'm struggling now to even find money, 70% of their salaries that have to be covered. So I wanted to just paint this picture to help you see that, you know, we've done well for almost 10 years. We've been able to maintain the work, the services that we've done. But again, it's largely been due to grants. I know, as I said, that funding is an issue. I would really be naive if I sat before you and said, you know, I'm expecting the county to just put dollars out for something that I know you're struggling to deal with other issues. However, as was discussed at the meet and greet, a recommendation was put forth that perhaps we could consider taxing residents. I'm a homeowner in the county, and if there were another $1 or $2 added to my tax bill, I would not miss it, and I wouldn't even quibble about it because I wouldn't probably even know that my taxes have gone up for $1. I am suggesting and hoping that this is something that this body would look into, or at least consider as a work group to see if it's even feasible, because we have to find a way of finding long-term sustainable dollars for the Family Justice Center. Afternoon, Councilman Chair Hawkins. Yeah, we have to find a way to really support the Family Justice Center because this is a resource that the county is utilizing, and public health, public safety, I would contend are the highest priorities of government. The Family Justice Center is addressing those needs, and it's something that I would hope that you would consider. So I have other slides, but I think really that's the most important. Lastly, as I said, the circuit court has taken this on, but really has not been able to sustain it. And so we have to find other measures. And I would like to, again, present and propose that it's something that you would consider. So with that, I say thank you.
Thank you. And I'll open it to my colleagues for questions or comments. Councilmember Fisher.
Thank you, Madam Chair. Thank you, Dr. McCain. It was great to visit the facility with Councilmember Hawkins. And I did want to say to colleagues and also to Ms. Owens for the administration, I don't know, well, Madam Chair will decide when my bill comes on the agenda for next meeting, but we do have the work group for a strategic plan around domestic violence, and I think that this would be appropriate in that as it's coming. It was read, I think, on council on Tuesday. So I do think like in that work group, that would be something to consider. And I do think the reason also I wanted to point to Ms. Owens is, you know, the budget drops from the county executive.
Yes.
And so it's something that, you know, would be also great to be considered there and not just the council alone. Not that we can't, but, you know, we have to agree 6 of us and change to change what a county executive drops for her agencies. So I did want to just highlight that to the public and to the conversation. And I definitely think, obviously you're in that resolution for the work group coming up. And I think we'll be tackling this aspect as many others. So thank you, Madam Chair.
Thank you. Any other comments? Councilmember Olson.
Yeah, thank you. I appreciate all the work that you do, and was there with Judge Surratt way back when she was making the rounds last time I was in office, and I'm so glad that this is you know, going on and changing lives and really working with people. I guess the first question I'd ask is, are you also speaking with state legislators? Because in order to place, I mean, if this is the mechanism, I mean, right? I mean, we have a former delegate that we don't actually have that ability to place on on the tax bills. I mean, it's a state level thing. I mean, we need state authorization to do that.
Okay.
So I don't know if that's something you've
Well,
talked to any of them about.
Not directly, indirectly, yes. And I'm working with Sheriff Carr and some other legislation that would involve the state, but this specifically has not come up, but it is something that I appreciate you
And of
sharing.
course, it's not necessarily the only way to
No.
get money, but it's, if that's something you're
We're
looking
starting
at,
small, trying
got
to
it,
expand
got
with
it.
it, but
Okay.
thank you for
Well,
that.
we look for, speaking for myself, I certainly look forward to working with you and helping to support. So, thank you.
Thank you.
Thank you, Councilmember Watson.
I don't have any questions, but I just want to make a comment that I just thank you for all of your hard work over the last 10 years in holding this down and holding it up. So appreciate all that you've done, and I look forward to supporting the task force and whatever we can do to make sure that, you know, what you're doing is sustained. And it's very critical work for the residents of our county. I certainly understand. So thank you so much.
Thank you. Much appreciate it.
Thank you. Councilmember Hawkins, did you want to say anything?
I'm on board.
Okay. And Dr. McCain, I just want to say, you know, in the past, I've been a financial supporter, and I just want to know that it was pretty alarming to see that my district does have the highest number. So we definitely look for ways to support. I know Angela Smith from my team is a part of your team, and she's kept me updated. And although I can't do Dancing with the Stars, goodness,
Well, that's coming up, and you can all individually support it.
I
by coming
know
out.
we can,
definitely do that.
but
Thank you.
I am gonna do what I did last time is support it regardless of the fact whether I'm dancing it or not. I'm gonna go ahead and do the same amount I did last year and the year before.
Wonderful. Thank you.
Thank you. And Councilmember Fish,
Yeah.
Hawkins.
Oh, I'm sorry. No, I want to thank you, Dr. McCain. As when Councilmember Hawkins and I came to visit you, we talked about, you know,
Yes.
continually having your data by district. And I think
Yes.
it really helps the council members, especially during the budget cycle and everything else, understand that it's not a territory fight, that every
Exactly.
single council member has residents, and the numbers are pretty even, obviously higher in Ms. Legaze. So I think it's always important as you continue to gain data to keep doing it by district. And it really, I think it will have a very positive effect.
Will do.
And I do encourage people to do the tour of the facility. I definitely did it my first year,
Please
and it definitely is very eye opening of just sort of seeing the spaces. I mean, I think the touching part was just seeing the safe space that you needed to provide. That was supposed to be a calming
Absolutely.
area.
It's important.
Just noting how personal this is. That just somebody just to have a place that they can breathe. Yeah, Councilmember Hawkins. Yeah. So. Thank you so much for this. We will share this with our colleagues and look for opportunity for you to present before the entire council. I think I'll speak with the chair about that. I think that's very helpful.
Okay.
But
Well, in closing, I just thank all of you for your support and leadership. And I know that it has been very personal for some of you, and that has been noted. So again, sincerely appreciate that.
thank you all so much. Do we have a motion to adjourn?
Move to adjourn.
All right, second. And we are, all ayes, we are adjourned.